doctors aren't invited, and neither are the governors. This bipartisan health care summit is pretty exclusive, and the governors are not happy about being iced out. Minnesota Governor Tim Pawlenty joins us. Good evening, Governor. Welcome to Washington.
I'm glad to be with you, Greta.
All right. Well, I guess you don't need to stick around for Thursday. You can go home.
Well, I did write a letter to the president suggesting that given all the experience that governors have with reform on the ground in their respective states, it would be good to have some governors there. Now, in fairness to the president, he did just have us at a conference here in Washington, so we did have a chance to visit with him.
All right. Now, if you went on Thursday, if you or other governors were invited, what would you do?
Well, I think we have a lot to offer as governors on either side of the aisle. We're the ones on the ground, the laboratories of democracy who've been experimenting with and succeeding with health care reform for lots of years. We went around the table the other day at the governor's meeting and just made a tick list of reforms that we think we could agree on a bipartisan basis. It's an impressive list. And
what do you say to that?
Well, the fundamental problem, I think, is this, Greta, just kind of cutting through all the smoke and cutting through all the usual, chatter by politicians. The reason this isn't coming together is Democrats are just obsessed about expanding access and not really containing costs. The Republicans are focused on containing costs first, and those two things aren't intersecting, setting aside all the details.
Do you think the president gets that great divide? Because it really isn't incumbent upon him. I mean, he is a Democrat, understandably, but he still represents everybody. If he's trying to achieve a goal, it might behoove him to try to merge those two interests and get some sort of bipartisanship in it.
I think it would. I think he does understand it intellectually. I think it's hard for conservatives to understand the passion for universal health care or government-paid health care or universal access to health care within the Democratic Party. That's been a movement, a very passionate movement within their party for 20 or 30 years. It's been upended in part by the election in Massachusetts. So they're very obsessed with that. Republicans are saying, look, there's a bunch of stuff we can do to control costs. But the Democrats, candidly, are not interested in that. They want the access expansion first.
Well, let's take it. I mean, I take it you're not opposed to a poor person getting medical care.
Absolutely not.
So a practical problem is if a poor person doesn't have medical care, gets sick, doesn't go to the doctor, goes to the ER, and that's more expensive. So, I mean, how is this on the sort of basic practical matter? What would you do?
Well, a lot of things that we could do, Greta, but the secret to all of this, in my view, is we're going to have to do some things around payment reform because we pay right now for volumes of procedures. The systems are out of control, regardless of how you or I feel about treating the poor. So you could absorb my costs? Could you absorb in my hypothetical, if you improve on the cost, the efficiency, you can absorb the person who's uninsured who elects to go to the ER instead of the doctor? Well, for one thing you could do is change the federal law so that not every ER is required to treat everybody who comes in the door, even if they have a minor condition. They should be, if you have a minor condition, instead of being at the really expensive ER, you should be at the primary care clinic.
Okay, but you come in with chest pains, and you could have horrible chest pains. Now, it could be indigestion, which is minor, or it could be heart, which isn't minor.
You have to do a little triage, that's for sure.
So the problem is, there really is it's not that easy.
The current system, we're all going to go bankrupt, Greta. It's not working. It's going up too fast. So under the Republican view, contain the costs first, get the system under control, fix the system, and then once it's fixed, expand access. The Democrats take the inverse approach, which is expand access wildly, raise taxes, grow government, worry about costs later.
It seems to me that the effort, both Republicans and Democrats come here and both want to fix it. And both want to make it better. It seems it's just so overwhelming to do it so quickly, so fast on something where people get scared about health care, that if we just sort of incrementally tried to achieve it, improve things so that we could see how each step of the way was working or not working. I think that's, when I go out and talk to Americans, they're afraid.
There's a number of very common sense incremental steps that we could take, see how they work, and then takes the next step. I will tell you that's the exact discussion we had amongst the governors these last 3 or 4 days. When you go down that list, or 6 or 8, there's a good number, though, of Democrats who say, you know what, that's not enough. We want comprehensive reform. We've been working on this for 30 years, and we're not just going to take the med-mal, the pre-existing conditions, the portability, and the payment reform. They want dramatic expansion of the current broken system.
All right, you get the Senator John Thune question. You running?
I'm jogging a little bit. Well, I'm still jogging a little bit.
I always do that, too, so I'm teasing you.
It's like Brett Favre. What are you going to do next?
I think you'll play, do you?
I do, too. I hope and pray he's going to play again.
Anyway, Governor, nice to see you, sir.
Thank you, Greta.
Coming up, hypocrite.